Bismillah, alhamdulillah, salatu wassalamu ala Rasulullah. Today, another good evening, we'll be talking about the trauma. So we had two episodes in the past. In the first one, we had to talk about what trauma is and how its problems are increasing as number of vehicles are increasing. Number two, we had talked about the mechanism of injury, like depending on where you got hit and you're injured at multiple places leading to disability or death. But today we'll talk particularly about the babies, the children, how we can protect them, and how we can revolutionize in the society, making sure that patients don't have inabilities or disabilities due to trauma. So if you remember rightly, we had talked about that the child's head is relatively double the body size than an adult. So child has a big head. And it's very hard for the neck to control it, so muscles are weak. So if a baby is sitting on the back or in front, what will happen? So it will be pulled forward 2 times faster. So this head, because child is lighter, go and hit it to the windshield, or it can go out and child can be dead at the spot. So that's how we should know that how important it is that the child should be strapped properly. So what is the solution? So there is something known as car seat. Although in international developed countries, it's a common phenomenon that you have to use seats, but in Pakistan and other developing countries, it's not much prevalent. I know there are certain rich people or educated people who are trying to use it, but majority we are not, don't know that how to solve this issue. So lo and behold, most important thing is car seat for the child. What is car seat for the child? So you take an extra tub or a seat and you put it on the back seats. So it's fixed with those buckles so that it doesn't move. So on that basement, you put on a chair which is attached or fixed with that bottom. So you put the child in that and you strap the shoulders and the body from the thorax to abdomen. So what happens after that? Parents can be very satisfied the child is well protected. So in the previous years, there was a theory that if you keep the child for 1 year of age facing backward, it will help the person to get any serious injury. For example, when the child's head is facing back, the face is facing backward, and if you apply brakes, the head will not damage itself, but it will come in contact with the seat, so child will be safe when there is a brake. But now what happened is, with passage of time, we found that 1 year is not enough. So for 2 years, you have to put the child strapped inside the car seat and face backwards so that his head is safe. So you can imagine how important it is, especially when we have highways and you get hit with something. It's a big problem. It'll be a lifetime disability. It can be death or anything else. So we as society have to take care, and we have to make sure that child doesn't have that problem. So once the baby grows up a little bit, and then it comes a time that we put the child facing forward. So child is very happy that I can see things properly in front. The baby is looking backward. First 2 years he is fussy because everybody is seeing the scenes, but he is not able to do that. After that, there are few years come when they are not young babies, they are not adults, but they're in between. So there what we do is we put a booster seat. So booster seat is fixed by the straps, and child is put on that, and you're easily able to strap with the car seat. And what is the question about that? Can child come in front? When child comes in front, there is another problem. That when you have accident, the airbags come out with power. It's coming such a power that if a child is less than 12 years of age, it can hurt the child. So up to 12 years of age, please don't put the child in the front seat. After 12, he is able to absorb it and he can be fine. And I've seen a very dangerous scenario where parents They take the child and they put in their lap, and now they're driving. So can you imagine that you hit into something and the first effect will be received by the baby or the child? So it can play wreck. So please don't try to love your children in a way which is very dangerous. Alright, so we'll talk a little bit about trauma, may talk some other time too, so that how we can hide that and make sure that our society is safe. Thank you very much.